So this week was on mental health. This is my reflection on some of the chapters. So one thing that did surprise me this week was just how common and deadly substance use disorders are, particularly opioids. I knew that there was a problem, but learning that over 700,000 deaths occurred due to overdoses in less than 2 decades hit a little harder. It was also eye-opening to read about how many of these prescription users transition then to heroin, something that clearly shows how thin the line is between treatment and addiction. I knew it, once again, I knew it was a public health issue, but seeing the numbers, such as 128 people dying every day from opioids, makes it a little bit more real and urgent. It will definitely make me think differently about opioid prescriptions that I might prescribe and write in the future. I was also surprised by how broadly substance abuse impacts the body. And it's not just about the addiction, it can cause infections, heart damage, liver disease, pregnancy complications, and even affect developing fetuses. So, as a future provider, that tells me that we can't treat substance use disorders as just a narrow mental health issue, that it is a systemic disorder and disease. Some things that didn't surprise me was the biological and genetic influence on some mental health disorders, such as schizophrenia and depression. It reinforced what I've previously learned and was aware of, that these aren't just emotional or behavioral issues that people are choosing, that it's a measurable neurological or chemical imbalance and disorder. Um, I was glad to see that confirmed in the materials with things like the dopamine hypothesis and schizophrenia or serotonin deficits and depression. And it kind of reinforced the importance of viewing mental health with the same seriousness as any physical disease. Three things I learned about mental health disorders. First, I learned that schizophrenia involves structural and chemical brain changes, including excess dopamine, abnormal hippocampal cells, and reduced gray matter. These biological differences explain some of the severe cognitive and perceptual symptoms that we see. So I now understand that the symptoms can vary significantly depending on which area of the brain are affected, such as gray matter reduction, hippocampal changes, or dopamine hyperactivity, um, which deepens my appreciation for just how individualized treatment plans need to be in psychiatric care. Second, I now understand how depression stems from deficit in excitatory transmitters, mainly serotonin and norepinephrine, which explain why some of the common drugs, such as SSRIs and SNRIs, are typically treatment plans that are effective. Um, the tie between neurotransmitter depletion and the symptoms really clicked, where it helped me understand why some patients might respond better to an SNRI versus a SSRI, depending on what they're deficit in. Lastly, panic disorders are linked to abnormal discharges in the temporal lobe and an overactive limbic system, which can help explain the physical symptoms such as chest pain, palpation, and even fear of leaving home, that they're not just making up these symptoms. Um, it's especially important going into primary care, as a patient might come in with chest tightness and palpation, and without doing a thorough history, it could be mistaken for a cardiovascular issue rather than what it truly is, a panic disorder or an anxiety issue. Three things I learned about substance abuse disorders. First, I learned how wide-ranging the effects of drugs can be, from cardiovascular damage with stimulants to brain damage from ecstasy or alcohol to fetal harm like fetal alcohol syndrome. Um, and also that psychological dependence can exist without addiction and vice versa. And that distinction is really important when evaluating patients that are on things such as long-term pain medications or long-term use of stimulants. Um, Next, I was surprised by how different substances interact, like how alcohol mixed with an anti-anxiety drug can cause a coma or brain damage due to the synergism. And even though both of those could be relatively safe on their own, and just how many people probably are mixing these two. Um, and then third, I didn't realize how deeply complex the treatment process is, especially for opioid use, and learned about methadone maintenance programs, which are controlled long-term ways to reduce withdrawal and prevent relapse, as well as other drugs such as antabuse for alcohol dependence. I also learned that withdrawal can be life-threatening and should be managed medically, and was struck by just how intense the withdrawal symptoms can be, such as convulsions, psychotic episodes, even cardiovascular risks. It kind of emphasized that detox isn't just a willpower issue, that it's a medical issue and in some cases a medical emergency. As a future nurse practitioner, I plan to work in primary care. Some things that I will take with me in my future practice is definitely screening for early warning signs, integrating some routine screening questions for substance abuse and mental health issues into intake assessments, especially for young adults, pregnant patients, or patients that have a chronic pain. Also, I'll make sure that I'm building trust with vulnerable populations, as many patients who are struggling with mental illness or addiction don't seek care because of the stigma and the fear of them being judged. So I would want to create a safe space where these patients feel like they can be heard and not penalized or afraid of being reported for disclosing the substance use, but safe to reach out for help. Next, in terms of referrals and coordination of care, I may not be the one providing addiction medicine directly, but can play a role in coordinating referrals to detox programs, mental health specialists, or social support programs such as Alcohol Anonymous. Um, I can educate patients and families and help people understand how drugs can alter the brain and mental health conditions can affect behavior to help lessen that stigma amongst one's loved ones, or if they have a loved one that's going through a mental health disorder, as it can be empowering for them to stay engaged in their treatment and know that there is a chemical imbalance, that it's not necessarily something that they're choosing. And then lastly, I will make sure that I'm attempting to prevent harm during prescribing, especially with drugs that can cause dependence, such as opioids or benzodiazepines. I'll rely on risk assessment tools, limit quantities, and avoid long-term use, especially um, focusing on educating patients on the side effects, the risk of the addiction and the dependence, and some alternatives for them. Um, Especially also with stimulants and paying attention to patients who are requesting refills early or um, calling for their doses to be upped very frequently, just paying attention to some of the red flags and warning signs. Lastly, I'll ensure pregnant patients are also screened for substance use and supported with the necessary referrals that they need to prenatal addiction programs and other support groups.